Billy Joel cancels tour due to normal pressure hydrocephalus. What you need to know. Renowned musician Billy Joel recently announced the cancellation of his upcoming concert tour, citing health concerns related to a condition known as normal pressure hydrocephalus (NPH). This diagnosis sheds light on a lesser-known neurological disorder that affects many and can often be misdiagnosed due to its subtle symptoms. Understanding normal pressure hydrocephalus. Normal pressure hydrocephalus is a condition characterized by the buildup of cerebrospinal fluid, CSF, in the brain's ventricles, leading to increased pressure that can cause a range of neurological symptoms. Unlike other forms of hydrocephalus, NPH often occurs in older adults and presents with a triad of symptoms: gait disturbances, difficulty walking, urinary incontinence, and cognitive decline. Despite its potential severity, NPH is rarely recognized early. Its symptoms can mimic other neurological conditions such as Parkinson's disease or Alzheimer's disease, leading to delays in diagnosis and treatment. However, with proper management, often involving surgical procedures like the installation of a ventriculoperitoneal shunt, many patients experience significant improvements. Billy Joel's diagnosis and impact. Billy Joel disclosed that his health issues stem from normal pressure hydrocephalus, which led to his decision to postpone or cancel tour dates. His openness raises awareness about the condition, encouraging others experiencing similar symptoms to seek medical evaluation. The singer emphasized that early diagnosis and treatment are crucial for improving quality of life. His case highlights the importance of paying attention to neurological health, especially in older adults. Other notable figures linked to hydrocephalus. While Billy Joel is among the few public figures to openly discuss their diagnosis of NPH, other celebrities and public figures have been associated with hydrocephalus or similar neurological conditions. Willie Nelson, the legendary musician, was reported to have experienced hydrocephalus as a child, which required surgical intervention. His resilience has helped raise awareness about early childhood hydrocephalus. Misty May Trainer, the Olympic gold medalist and volleyball star, was diagnosed with hydrocephalus as a child, which she overcame to become one of the most decorated athletes in her sport. These examples demonstrate the varied experiences with hydrocephalus across different ages and backgrounds, emphasizing both its potential severity and the importance of medical intervention. Conclusion. Billy Joel's public acknowledgement of his normal pressure hydrocephalus diagnosis underscores the importance of awareness surrounding this condition. It is a manageable neurological disorder, especially when diagnosed early. If you or someone you know is experiencing symptoms such as walking difficulties, urinary issues, or cognitive changes, consulting a healthcare professional is essential. Advances in medical treatment offer hope and improve quality of life for those affected.
We talk a lot about how this place is like a family, and this morning we have some heartbreaking news about someone who is very dear to us here at Today.
Shaynell Jones of the Today Show loses husband to brain cancer, glioblastoma overview and condolences. Shaynell Jones, a well-loved co-host on NBC's Today, has recently faced a heartbreaking personal tragedy. Her husband, Uche Oje, tragically passed away after battling glioblastoma, an aggressive form of brain cancer. Fans and colleagues worldwide have expressed their heartfelt condolences during this difficult time. Shaynell Jones, a distinguished career on The Today Show. Shaynell Jones has been a familiar face on The Today Show for several years, renowned for her warmth, humor, and professionalism. She joined NBC News in 2004 and has since become a staple on morning television, covering everything from breaking news to human interest stories. Throughout her career, she has been admired for her authenticity and resilience, qualities reflected in her recent public notifications about her husband's illness and passing. The heartbreaking loss. The news of Uche Oje's passing has deeply touched many. In various social media tributes, colleagues and fans have shared their sympathies and support for Shaynell Jones and her family during this profoundly difficult time.
After a courageous battle with an aggressive form of brain cancer called glioblastoma, there are no words for the pain that we feel for Shaynell and their 3 young children. Uche was an incredible person. We all loved him.
Understanding glioblastoma, symptoms and treatment. Glioblastoma, also known as glioblastoma multiforme (GBM), is the most aggressive and common type of primary brain tumor in adults. It accounts for approximately 15% of all brain and central nervous system tumors. Despite advances in medical science, glioblastoma remains challenging to treat. Symptoms of glioblastoma. Symptoms can vary depending on the tumor's size and location, but commonly include severe headaches, seizures, changes in personality or behavior, nausea and vomiting, weakness or paralysis on one side of the body, vision or speech difficulties, cognitive impairments. Because symptoms often develop gradually and overlap with other conditions, early diagnosis can be challenging. Treatment options. While glioblastoma is currently incurable, treatment aims to prolong survival and improve quality of life. Standard therapies include surgical resection, removing as much of the tumor as possible without damaging essential brain functions, radiation therapy, targeted radiation to destroy remaining tumor cells, chemotherapy. The drug temozolomide is commonly used concomitantly with radiation and afterward to slow tumor growth. Targeted therapy and clinical trials. New treatments are continually being explored, including immunotherapy and personalized medicine approaches. Despite aggressive treatment, glioblastoma often recurs, and prognosis remains poor, with median survival around 15 months post-diagnosis. Conclusion. The passing of Uche Oje is a stark reminder of the devastating impact of brain cancer. For families facing such diagnosis, early detection and continued research are essential in improving outcomes. The medical community remains committed to developing more effective treatments for glioblastoma, offering hope for future patients and their loved ones. Our thoughts are with Shaynell Jones and her family during this profoundly challenging time. Online condolence messages and support continue to pour in, honoring the memory of Uche Oje and expressing sympathy for those affected by brain cancer worldwide.